Hey, what is up, people? How you doing today? It's LeeAnna here, back with another video. And today we are talking about meds. Meds. I take so many medications. I think I've heard of people taking more. I'm sure I have. But I take quite a bit, more than I think I should be taking anyway. And just list off the types of medicines here that I take. Thyroid meds, fibro meds, mental health meds, acid reflux, heart meds, cholesterol med, anti-anxiety, and then there's a whole host of supplements, which is iron, magnesium, biotin, vitamin B6 complex, C, D, fish oil, Tylenol, and then I take a probiotic, and then I take a hair serum to kind of try and get this hair to grow back a little bit more. So that is a lot, and I want to go through these, and I want to tell you about them and tell you what experience I've had with them. So let's go. Okay, thyroid meds. Here's something that I don't think I've ever really told you all. In 1998, I was misdiagnosed as bipolar. Misdiagnosed at the time, based upon the information that everybody had at the time, including myself. It was a misdiagnosis as far as I was concerned with bipolar type 2. Okay, type 2. Which means no really high manic episodes. It just means that you're kind of like on an even keel, but you dip into depression and then you have a little bit of a high and then you come back down. So it's not like all like this, And what ended up happening was I was going to see my doctor for it, because when you have a mental health illness and you take medicine, it's a psychiatrist that you see that prescribes it normally. Your general practitioner, general physician can prescribe it, just like maybe some depression pills, like maybe Paxil or Prozac or whatever, just to kind of lift somebody up a little bit. But when you're in with a lot of different types of medications for mental health, and it's obvious that you need something a little bit stronger, that's when you're going to end up at a psychiatrist's office, which is fine. They only see you for about 15-20 minutes. They ask you some questions, you give them some answers, and then they write you a prescription. And I never have a problem. But back then, though, in 98, I was seeing a psychiatrist for that year and the next year and the next year and the next year. And during all those years, I was on several different medications for bipolar disorder, which I did not have. Unknowingly at the time, one of the meds that I was taking was lithium. And we did not realize at the time that I didn't have bipolar. If I would have, lithium would have helped, and so would all the other medicines. They would have done something, but I didn't respond well to them. I actually overdosed 3 times, because they gave me, if you're trying to take a pill for a certain mental illness, and you don't have that mental illness, you can get really weird and not wanted, effects of it. Like I said, I took 3 overdoses. So I determined with my counselor, they didn't work really well hand in hand, but with my counselor, and we didn't think I was bipolar when we brought it up, when we were talking about it. So ended up going off the pills. Well, and I ended up saying, I'm not bipolar. I don't think I'm bipolar. And he said, I said, I need to wean off of these because you can't just stop taking them. And he said, well, you'll be back here in 6 months. I never went back. And I didn't need to go back either. But here's what happened with the thyroid med. I ended up going on that because I ended up with a lump in my throat. And it was kind of like, it was right up here. Or no, it wasn't there. It was off to the side down here. And went to the doctor. They did a biopsy, which to do a biopsy, they had to put a needle into my throat and pull. Yeah, it's really gross. And I couldn't breathe and I couldn't swallow while he did it. It was weird. But so I had that done, but unknowingly to us, when you're on lithium, one of the side effects that lithium might cause is a thyroid problem. And what my thyroid problem ended up being was my thyroid stopped functioning properly. So, and it had just like I don't even remember the word, to assist, just a cyst, just a little spot of tissue, soft tissue. So he put the needle in and had to pull it out and kind of aspirate it a little bit, put me on medicine. And then he put me on the thyroid pill, which I have to take every day for the rest of my life. Your thyroid, I didn't even know what it was. And you can look that up or on Google it or whatever. Your thyroid basically controls and helps regulate everything in the body. So without that, I would not have done very well at all. So that is that medicine. It's that's a little story for you though. For if you're taking lithium, you need to get your thyroid checked, your thyroid levels. Now, I also take for my fibromyalgia, I take Lyrica / pregabalin. It's the same med. I take it for and it's good for fibro, for nerve pain, for restless leg syndrome, and for seizures or epilepsy. And I take it, and let me see here if I can pull this up. Okay. So I take Lyrica um, for those uh, for those issues, and they put me on fibromyalgia the day that I went to the doctor thinking I had chronic fatigue syndrome or fibro. So she just pulled out her prescription pad. She did like the tender point test, the shoulders and jaw and wrists and elbows, and you touch right, not in the joint, but right above the joint or next to the joint. Whatever you're in, you kind of apply a little bit of pressure, and if it's very painful, that means that soft tissue around the joint is has problem, and you may have fibromyalgia. That's how they tested it on me, and this was back in 2007. So it was some years ago. Now I don't know if they tested the same way or not, but okay. She put me on Lyrica right away, and she put me on, I think it was 50 or I think it was 75 twice a day, 75 milligrams. Well, now I am up to 300 milligrams twice a day, which apparently the doctor said apparently this is, I didn't know this, but he said that it's one of the highest dosages that they give. But she put me on Lyrica, and it was awesome. It just really helped with because I couldn't pick up a coffee cup full of coffee, a gallon of milk without it hurting my thumb joint. I couldn't write anymore. My hand would go numb. Little things like that. Tying my shoe, I had a problem with laces. So you lose your movement, you control your movement, which that's the nerve thing. That's what Lyrica helps. So I don't know how bad my nerves would be without Lyrica, but I know that when I started that, I never had anything but good, come from it. One of the things that happens when you have fibromyalgia is fibromyalgia patients tend to feel like they have the fever or the flu, fever, the fever, but sometimes they get this feeling like they've got a real bad fever right behind the eyes here, and that they've got the flu with the body aches and that kind of like, I'm getting better, but my body just hurts so damn much. That feeling, that feeling doesn't go away ever. The fever feeling, the Lyrica takes away for me, and it's different for every person. but the aches and pains are still with me. Yes, they are. And here's the thing with fibromyalgia, it's not fatal, it's not terminal, it is chronic, but the symptoms, the things that happen, like the fatigue and the other things that I've talked about in other videos, and the extreme achiness, those things just get worse. So, yeah. I've had fibromyalgia for 14 years and I've pretty much been in pain. And now I am to a point where I actually am good. This is a new thing where I stutter. My jaw jerks instead of just somewhere in my body. My jaw's starting to do it. I am getting ready to go to a pain center again and see what can go on with that, because I'm having this really bad pain in my my right calf muscle. So I'm not sure what that's from, but I need to go and get that checked as well. So anyway, that's with Lyrica. And the next medicine is omeprazole, and that is for acid reflux. I've been on that for 20 years. It was Nexium at first, and now then it was um, Prilosec, and now it's omeprazole. And then with my heart failure, I take Entresto, um, spironolactone, and metropolol. I went into heart failure in 2017, and those three meds they are doing what they're supposed to do in supporting my heart and keeping it going. What happened was I first went into heart failure. My heart stopped functioning as strong as it should be. It was pumping very slow and very weakly, very weak. Um, not good enough at all. And they did a heart cath. I had no blockages. Everything was clear. And he came out and told me, he took my hand and he held it up to his chest and he said, "My dear, I am here to tell you, I'm sorry, but you have a weak heart." Okay, so what did that mean? Well, apparently my heart was so weak that I could have gone into heart failure, cardiac arrest, I mean, and died. Now, this was in February of 17. I was 45 years old. Um, and that was just not something that we were ready for. So I got to wear this nifty little device called a life vest, which you wrap around, and it's got leads that stick on the inside, next on the side of my body, and then in the front, um, and it's attached to this big battery that is like on a camera case type of thing, and it's this big. You can't really tell how big that I'm doing it, but it's like this big. It's a fairly good size. I want to say maybe like 4 inches wide and about 2 or 2.5 inches tall. And it was heavy as a brick. It was about the size of a brick, actually. Now that I think about it, it was so heavy. So I had to wear that battery all the time, take it with me. It was just strapped on, big long strap. And they sent me to cardiac rehab, and that was supposed to help. And medicine was supposed to help right away, and none of that stuff would help. So then finally in October of 17, I got a pacemaker. And what a pacemaker does is it doesn't keep your heart beating, it tells it when to beat. And thankfully, my heart finally responded to that because it was pretty grim. So those are the meds I'm on for that. Now I'm also on for major depressive disorder, uh, Wellbutrin. That's for my depression, my depressiveness, or my depression. I also take Abilify, which was described to me as a medicine that kind of makes all the other medicines, just kind of links them together and just kind of supports them up like a canopy or something, supporting the other medicines that are there. And it helps a lot. I also take amitriptyline, which is, I'm not sure exactly what type of medicine it is, but it's a medicine that does a bunch of different stuff. I take it for, she gave it to me because it was known to help with fibro, help with anxiety, and help with falling asleep at night, which were three big problems I was having. So I took that and I started going to sleep so much easier. And then those are all of the prescribed medicines that I take. And the reason that I'm telling you all of this is it's not as important as the relationships that I have with my doctors who prescribe them. When you have a provider and you are able to work with that provider closely and all the time consistently, and it's not like a doctor you go to when you're sick and need, when you got tonsillitis or you got the flu or whatever. These are doctors that they want for you what you want for you bad, and they will go to, whatever they have to do, I'm sure, to get you better. And you have to work with those providers. You have to develop a relationship with them. My primary care doctor is a doctor that I have known since 1995 when I moved here to North Carolina. And my family had started going to him, and so I just started going to him. And he has known me all of these years for 25 years. And he's a great doctor. He's my main doctor that I go to. And everybody loves him. It's not just me. He is like the most popular doctor. That's just his personality. That's his person. It's not, he's a great doctor. He has great bedside manner. And he can basically tell you anything with this and make you feel like you just won some award by him talking to you. I mean, he's great. He is so great. And the people that he has referred me to, because I've had knee replacements, I've had an orthopedic surgeon, I've had a cardiologist, and I've had a cardiac surgeon. I've had, what else? Oh, the psychiatry, and um, and other people that have stepped in that checked on me in the hospital that um, I had to see because the other one was out of the office or was not on rounds, or people would different ones would come. So I ended up getting this fantastic group of doctors. Now, I cannot stress this enough. If you don't have insurance, find out what you need in order to find you some good doctors, okay? There are lots of different programs out there now. I don't really know what they are. I'm not the person to ask. And also, by the way, I'm not a medical professional. This is not a medical advice channel. This is a medical experience, a health experience channel. And it's a peer-to-peer channel where I can tell you what happened to me so as you can get inspiration from it and also say, okay, well, that's kind of like what happened to me, so that kind of makes me feel better because of the validation. So that's what this channel is. I am not a medical professional, and I will not be held to anything that I say as far as like she told me to do it. No, we're not playing that. So, yeah, so that is that. But you need to, if there's one thing that I could say, you need to find out what you need to do in order to get a fantastic team of doctors. Because when you have a fantastic team of doctors and you work with them and they know you and they know how your body reacts to things and they know your personality and how you're going to react to things, that doctor can prescribe you just the right medicine. They will know without having to go through a bunch of trial and error. They will know pretty much down to like a handful of medicines which ones are going to be the best for you. And you have that trust with the doctor and you work with them closely. So I'm going to say that the medicines that I'm on, yeah, I get side effects. Here, I'll tell you the list of side effects that I get. I have dry mouth and stuffy nose. I have allergies anyway, so and a lot of these things, it's hard to tell where they're coming from, which medicine, but these are just common medicine side effects. Some blurred vision. I have stigmatism, so I have I have no clear vision. I have all blurry vision. Nausea, vomiting, stomach pain, loss of appetite, constipation, all of those things can be very easily affected by any medicine that you take. It's not just limited to the medicine that I'm on. Sleeping problems, tremors, sweating, feeling anxious or nervous, fast heartbeats, confusion, agitation, hostility, weight loss, headache, dizzy, or muscle or joint pain. Now, like I said, those are all pretty standard side effects that you can get, and they all tell you to monitor, and take it before you try to drive a car. So, or operate any other heavy machinery. So that is basically, I know it was probably a boring episode unless you are really wanting to know about the medicines, but my bottom line is it's about the providers, definitely. So if you like this video, please give it a thumbs up. Oops, the wrong one. Thumbs up. Subscribe and click the bell for notification so that you can be notified next time I put out a video. I really appreciate it. I love you all, and I will see you